conditions mothers tend to worry about. So one of the things the mothers often come is at birth, few days after birth, the child has a rash on the face and body. We have a fancy name for it called erythema neonatarum, but it's nothing to worry about unless there's forming pustules. If the pustules are things like pimples, then you should go and see a doctor. 40% of normal children have this. Children also, few weeks after birth, tend to have a bit of noisy breathing, especially children after cesarean, because normal birth they get crushed, they get compressed during the passage through the canal, and most of the fluid in the lungs comes out. Caesar, it doesn't happen, so they tend to be what you call snuffly children. They tend to have a little noise, and their nasal orifice is not like ours, it's very small. Even their bronchioles and bronchioles, so what we hear is an exaggeration of the true thing. So a lot of mothers come, what you need is, you can be very careful, you hold some steam. Sometimes we put coriander into the water and boil the water and put it towards the child. Of course, you must be very careful because you know the harmful effects of boiling water. If it still continues, then after visiting a doctor, sometimes nasal drops are prescribed, sometimes saline, which is not a medicine. It helps to clear the mucosal effects of the nose, and the children start breathing normally. Crying children is another thing mothers often fret about, and sometimes they feel that they don't have enough of milk, and they panic and they feed the child very often. So by feeding the child often, the child won't get the adequate total amount of milk because he is neither hungry nor full. So the child may actually lose weight, and the mother gets more and more anxious. And sometimes, when you get anxious mothers, the breast milk flow is interrupted. So there are different reasons why children cry. Loud noises, when they wet their nappy. Sometimes before passing urine they cry because a full bladder is an unpleasant sensation for adults. The child, the neonate, the small baby feels worse. And when they do poo, they tend to cry because the nappy is soiled, and sometimes it's normal for a newborn to go even 20 times. The breast milk tends to pause, the stools go more frequently, and sometimes as you feed the child may pass a stool. That also is normal. So there are other reasons which older child cries. We put various toys which we feel are cute, but some of them are actually quite scary. So it's very important to keep the quiet atmosphere. And also if the child is crying, always carry the child. And it's better to hold the child onto the left side, because right toward pregnancy, most of the noise he hears is the mother's heartbeat, which is the most reassuring noise. So when you hold the child onto the left side, the beating of the heart reassures.